And welcome back to Ask the Doctor. I'm your host, Mike Berger. Here to answer your questions about aesthetic surgery is Dr. Robert True with the True Aesthetic Center. It's a leading facility in cosmetic surgery, as well as age prevention and associated therapy treatments. And Julie from Kennedale is on the line. Go ahead with your question, Julie.
What's the difference between a breast lift and a breast augmentation?
Dr. True.
Well, a breast lift is where we lift the nipple areolar complex so that it points forward. The idea of any kind of breast surgery is to try to make it in such a way so that you have a beautiful breast. So that's the concept that we have in mind. When we do a breast lift, a lot of times the breast nipple areolar complex are pointing down. We try to lift them up. We reposition them so they're pointing forward like beautiful breasts should be. And a lot of women need to have some upper pole fullness, some fullness of the breast up here. So we can't just put the fat from here to up here. We have to lift it up, and so therefore we do an augmentation. With an augmentation, we insert implants underneath the muscle or above the muscle, depending on the situation, in order to give a woman a more enhanced look to her breasts. We can do that with a breast lift, or we can do it separately by itself.
Now, I think we have some pictures of a before and after here, Dr. True. You can tell us a little bit more about it.
This is a patient who had just a breast augmentation. She wanted to have a little bit prettier breasts, a more augmented breast, fuller breast tissue. And so we did an augmentation, and we can see the after picture here, where she has now very voluptuous, beautiful breasts. And this was done with the use of the local technique, where she was awake during the entire time. She was talking to me the entire time. The breasts were all numb, and she felt no problem, no pain.
And now we have another question from a viewer. Becky in DeSoto wants to know, what's safer, silicone or saline for implants? And Dr. True, see, we started out with silicone, didn't we, and kind of had some problems?
We did, yeah. Silicone implants are still available. The old silicone implants, they were having some problems, but the reality is most of the studies say that even the old silicone implants were not as bad as they thought they were, but we have some newer silicone implants. But the reality is any kind of silicone implant can bleed a little bit of silicone on the outside, which can cause a reaction. And this reaction can cause some scarring around the implant, which can result in some hardness and firmness. Saline, in a way, is a little bit safer, in my opinion. If it ruptures, you don't have that silicone come out, you have just normal saline. And the look is the same. The look is the same whether it's silicone or saline. Both of them form beautiful breasts either way.
And with saline, can you, as you go on, you can add or subtract if you want to?
Absolutely. Well, have a minimum amount that you have to achieve. When a woman comes to us and wanting breast implants, what we do is we have her kind of do some sizing on her breast to see which one she wants, because I want to do what she wants. Sure. I want to give her the breast that she desires. So we can do some sizing. But, you know, there's always that 50 cc's or so difference. Well, I'm not sure it should be this one or this one. And with the awake procedure, when we do the procedure and we put the implants in, she can look at the breasts and she can decide, well, yeah, you know, I think I wanted the larger one instead of just the regular level. And that's a nice advantage of doing it the awake method, is so that the person has a little bit more choice.
Good idea. Thank you, Dr. True.
Absolutely.
Dr. True, thank you so much for joining us and being with us to tell us all about the Aesthetic Center. Again, Dr. True, thank you so much. I'm Mike Berger. Have a wonderful day.